All right, I'm going to go ahead and get us started. My name is Michelle Savio. I'm the Director of Technical Assistance with the National Center for Adoption Competent Mental Health Services. And I would like to invite you to our webinar today, Fiscal Foundations for Mental Health Services and Child Welfare. Thank you for joining us. A strong financial strategy is key to successfully delivering high quality mental health services to children and their families that are impacted by the child welfare system. Yet often this can be proved to be a challenging issue and a very complex in practice. Our presenters today will address this critical issue, including exploration of primary funding sources, foundational principles for fiscal infrastructure, productively making the case for investment, and developing a foundation for sustainability. So I'd like to introduce our presenters today. Dennis Blasey, a former budget and fiscal officer for the Office of Children and Family Services for the Ohio Department of Job and Family Services. He served in that capacity for about 22 years until his retirement in 2007. Dennis is now a nationally well-regarded expert on child welfare finance programs, policies, and strategies. We also have Morgan Cole. Morgan has worked across multiple sectors to increase access to high-quality health and social support services for vulnerable populations. She has experience with an emphasis on equity, systems integration, and optimization of state and federal funding streams. She currently supports multiple states and jurisdictions in aligning their fiscal strategy with broader health system reform experts. And so with that, I would like to turn it over to Morgan, and she will start our presentation today. Thank you.
Thank you, Michelle, and thank you everyone who's able to join. If we can go to the next slide. So this gives a quick overview of what we're hoping to cover today, much of which Michelle already touched on a bit. So kind of making the case for investing in these types of services, some of the foundational principles to really be aware of around your fiscal infrastructure. A few quick snapshots of innovations that are happening nationally, as well as some of the fiscal levers for implementation beyond just thinking about which funding streams are going to be able to fund what. There's a lot of other pieces to consider as well. And then we'll close out with some Q&A. Next slide. And you can actually go ahead and advance to the next one as well. So I think this information is not going to be new or surprising to a lot of folks on this call, but I do want to spend a moment talking about what is the case, particularly the fiscal case for investing in high quality mental health services for child welfare involved kids and families. So obviously the human and the ethical importance of doing so should be foremost and should be enough to do the right thing. But there are also strong fiscal incentives as well, based on, in part, the cost that this population often bears in the medical system and elsewhere. So there's a few data points up here that highlight some of that, but what it comes down to is that children who have child welfare system involvement disproportionately experience mental health challenges for a variety of reasons. Their medical costs, and particularly their behavioral health costs, are significantly higher than the general population, and even when you're looking specifically at the Medicaid population. So, in this particularly striking piece of data here, among children that are enrolled in Medicaid, those with a mental health condition account for less than 20% of the population, but more than half of the spending. These impacts are often long-lasting, with that pattern of disproportionate impact really carrying often into adulthood, unfortunately, and showing up as costs across a range of systems. Next slide. So as I just said, investing in high quality mental health services for child welfare involved families is not just the right thing to do for kids and families, but also the right fiscal decision, both in the short and long term. And luckily, we know from evidence and decades of research that high quality mental health services do exist and they have tangible impacts. So we have this wonderful kind of self-reinforcing scenario where investment in quality mental health supports can lead to better outcomes for kids and families, which often then leads to an improved fiscal landscape, whether that's through cost avoidance or other benefits, which then frees up more dollars potentially for investment in further supports. So this really is a win-win situation. In terms of the evidence around the efficacy and opportunity of services to have these kinds of impacts, there's a lot out there, and many folks on this webinar are likely very familiar with them. I'll cite just one of them. There was one study a few years back on the impacts of treatment foster care. So getting high quality services, many of which were mental health, behavioral health services in a community setting compared to residential care for youth with the same, types of profiles. Those that were placed in these community-based, high quality TFC settings spent on average more than 2 months less in locked settings than their peers, with an estimated annual cost savings per child of more than $180,000 compared to residential care. So that's just one example. We know that a lot more are out there. Next slide. So in thinking about the role of financial or fiscal strategy in systems decision-making processes, there's a couple things that Dennis and I really want to underline. One is that the North Star of your fiscal strategy should always be supporting effective programs. So it should not be saving money. It should not be, maximizing your federal revenue. It should be supporting effective programs in doing what they're supposed to do for kids and families. So that objective and whatever you're trying to achieve for kids and families should come first. The money should be secondary in terms of your decision making. However, we know that the reality is that, fiscal considerations are real and often can be something that can tip a decision one way or the other. So it's valuable to be familiar with some of the things we're talking about today and to be able to effectively make the case of why investment in a particular service or initiative or effort may have a return on investment or have fiscal benefits if that's the case. Next slide. So this visual is, clearly a bit of an oversimplification, but I think a nice way of summarizing some of the ways in which placement costs in particular can be impacted and lessened by disrupting a few key points. So in a child welfare system, placement costs tend to be the primary cost driver. It's what the biggest component of spending in most systems is. There's a few different pieces that contribute to what those placement costs are that you'll see here. So one is setting. Some settings cost a whole lot more money than others. Entry, so how many youth are actually coming into the system, or particularly relevant to instances of adoption, re-entering the system. And then what's the duration of their stay? How long are they staying in the system? So each of these components, there's an opportunity to disrupt them, right? To impact costs by strategically targeting those in ways that can both improve outcomes and decrease costs. We want to have kids in family settings whenever possible. We want them only coming into the system if they absolutely have to, and we want them getting back to families as soon as possible. So improved mental health supports have the potential to do all three of those things, which is a beautiful thing and one reason why they are such a valuable investment for systems to make. I'm going to turn things over to Dennis, and we can go to the next slide to take us through some additional considerations and factors.
Thank you, Morgan. These points here on this slide reinforce what Morgan just discussed. Fiscal considerations should supplement but not drive decisions. But it's important to understand what those fiscal considerations are. The other reality is understanding what costs a child welfare system money. And again, reinforcing what Morgan just touched on, placement costs are the primary drivers in child welfare agencies. Roughly 70 cents on every dollar that's spent in a child welfare agency these days is associated with direct transfer payments to either foster parents, kin providers, or private placement resources for the care of children that are in custody. The next thing, again, is to find the disruption points. Understand within the fact that you're trying to disrupt these placement cost drivers, strategically look for those disruption points. And that's going to require, and we'll go into this in a little bit more detail, to do forensic analysis of what's the causational factors that are causing people to come into care, impacting duration, and so forth, so that you can then target those points. Further refinement on targeting comes into geographic density as well. Sometimes you may find that the saturation or the disruption point needs to be done in more rural jurisdictions than urban jurisdictions. So there's going to be all sorts of analysis that's going to need to be done, but it needs to be data-driven, absolutely data-driven in order to identify your disruption points. Consider the sequencing. Again, this comes down to where do you want to go first? It's very important to choose your targets and then to have a game plan or a business plan, and we'll talk about that in greater detail coming up, as to how to execute and measure your success in disrupting those targets. Finally, you're going to need to measure actually the fiscal impact and potential ROI. This becomes very persuasive as regards to the next bullet point, which is considering your audience. You're going to have to be making this pitch and having this discussion, not only at the beginning, but over time with a variety of audiences, providers, the community, appropriators, as well as your own internal decision makers. So all of these things will help you formulate your narrative for the audience that is going to hear it. It's very important to understand your audience and what they want to know and what you need to be able to deliver in order to inform them on that point. Next slide, please. So what we're going to move on to in a moment is actually a real live analysis that was developed for an actual client in a county child welfare system that does some of those things that we talked about, where they went in and did the forensic analysis and so forth. And it actually looked at what was the break-even point, so to speak, over a 3-year investment horizon. So let's move on to that slide right now. And that's the next slide. So here is a very, 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 I want to stress it, very simplistic analysis of what was done in this particular county. They had an idea of what it was. This was actually done, but the principles are exactly the same. This was actually done to implement family first. So they wanted to essentially disrupt patterns of entry and re-entry, which can include, of course, the adoption population. And they were willing, over a 36-month time frame, to budget $30 million for that purpose. That's the $30 million you see in the yellow box. That $30 million would be made available over the entirety of the 36-month process It wouldn't be tranched as a certain amount in the first year, second year, or third year. It was going to be universally available, essentially universally appropriated in the first year and available over the entire term. The next number, the $18.8 million, is bed days. Now, bed days is a concept that may be foreign to many of you, but it's actually the currency of the cost currency of child welfare. Child welfare cost centers, like we previously indicated, are primarily driven by placement. Those placement costs are primarily consumed in bed day transfer payments, either to foster parents, kin caregivers, or private providers. It's really then, how do you disrupt bed days? You can disrupt bed days by disrupting entry. You can disrupt bed days by impacting setting type. You can disrupt bed days by re-entries, and you can disrupt bed days by duration. All of those factors will ultimately echo in the number of bed days that are consumed over time. In this particular instance, we did a 5-year review analysis of the number of bed days that they were looking at within their targeted populations. Now, this is a very large metropolitan county. And they basically, and then we projected that over the next 36 months, what the trend line was. The internal projection based on prior trends within their target population was 18.8 million bed days would be consumed over the next 36 months. And that was going to cost them approximately $833.44 million over the next 36 months. The weighted average number of bed days, thus, was then essentially $44 after you back out any federal reimbursement that was going into that process. The number of bed days that was going to need to be at a weighted average of $44 a day non-federal share that needed to be taken out of the system, and this is the number that's in the second green box, was 443 days over 36 months. It didn't matter if it was at the front end, it didn't matter if it was at the middle, it didn't matter if it was at the end. So long as the trend line was disrupted by 677,443 days over the next 36 months, that would be the amount that would be required to break even on the $30 million in investment. That was basically 3.6 days. As it turned out, further analysis indicated that basically you only needed to essentially, for example, within duration, disrupt a duration span by basically 3 days across the target population in order to achieve that amount. So what this indicated was that this analysis indicated that there was a high probability of success. It also suggested and showed a path as to how to get there, and then spawned the next question. And the next question was, well, now we know that the target is reachable, the target is doable, we know who we want to target, we know what we have to disrupt, and we know by how much we have to disrupt it in order to at least break even. That spawned the next question, and is, what is it we buy? What is it that we do in order to get there? What do we have to execute on in order to get there? And so that essentially then spawned the next series of questions. Next slide, please. And we'll move on to the next one. These are the foundational principles that came up. So we first of all, by doing that analysis, essentially created a business case. We demonstrated that it was doable. We demonstrated who it is we wanted to impact and why we wanted to impact and by how much we needed to impact over a defined investment horizon, that activity. That then in turn, and I want to stress, these all need to be done in sequence. They are all predicates to each other. The next thing was to create a business plan. That's again, how to execute, what to buy, when to buy it, where to go. Do we saturate in certain geographic areas or within certain ethnicities? All of those things were very hard conversations to have, but necessary conversations, because it creates those foundations for success. Next, we also started to identify what were going to be realities. And we'll discuss those in the next slide, next couple of slides. But we discussed the realities, the operational friction, procurement regulations, all those types of things needed to be discussed, planned for, and have strategies regarding. We also then made sure, and I worked with them on this, to be fully transparent and fully accountable for everything that was going forward. This is a long-term haul. This is not something you can do overnight. You've got 36 months. You need to be working diligently over the entirety of that 36 months. This is not one of these things where there's a big fast start and then it glides into oblivion. This has to be constantly tended in order to ensure success, because then what success does is success fosters sustainability. When you can demonstrate success and you can demonstrate outcome and you can demonstrate impact, you have a much easier conversation with appropriators over time. And these things start to become then essentially self-sustaining. And it's very important to understand that your end goal is not only effectiveness, but sustainability. Next slide, please. So, in creating the business plan, business case and business plan, here are the steps. And I sort of outlined them before. Define the problem. You're going to need to do that with forensic analysis. You're going to need to then detail the consequences of inaction. What happens if we don't? And again, that's going to be driven by the data in the forensic analysis. Identify impacted partners. These may be providers, these may be other state departments, all those types of things, because those are parties that you're going to have to identify ahead of time to be able to work with. And then envision and define your desired end state. What is your desired end state? Where do you want to be at the end of this period of time? And have quantifiable measurements for that. Then the business plan is essentially, you're going to need to detail your course of action, set your investment horizon. I always recommend on these types of things a minimum of 36 months. Define measures of near-term, midterm, and long-term success and failure. And I want to stress that failure is not the mere absence of success, and that success is not the mere absence of failure. These need to be considered and talked about individually. When do you know something is working? How do you know something is working? And then in turn, and conversely, how do you know something isn't working and failing? And why is it failing? Next, consider doing as your first step before going massive, so to speak, a proof of concept model. Think of it as a pilot to measure the near-term, near-term success. Proof of concept is very important. It will allow you to experiment. It will allow you to prototype. It will allow you to test your theories in discrete markets, for example. You may have separate proof of concept models for rural jurisdictions, suburban jurisdictions, urban jurisdictions, certain ethnicities such as tribal organizations. These essentially allow you to discreetly understand your business and craft your business plan going forward for each of these sub areas. Then finally, execute and evaluate. It's extremely critical that you have to consistently and diligently execute with fidelity and continue to evaluate and be entirely transparent on that. Next slide, please. All right, so here are some of the key considerations. We sort of touched on these. Realities. In every public agency, there's operational friction. It's inevitable. Plan the timelines accordingly. Many of you in the audience who probably work in public agencies know how long it takes to contract, how long it takes to execute grant agreements, how long it takes to modify IT systems if it's necessary. These are all the operational realities. Identify them at the beginning and work on them immediately, but understand they're going to exist and plan your timelines accordingly. Also, though we will be discussing in part later the use of federal matching funds, be prepared to understand that federal matching funds are only going to cover a small portion of your total cost, not only in the beginning, but also over time. The reality is that approximately 60 cents on every dollar is going to be your own money. That makes it very important to get results for those expenditures so that you have sustainability over time. Next, transparency and accountability. Embrace stewardship. I cannot stress this enough. It's very, very, very important to let appropriators, taxpayers, and the community know that you're investing the money to benefit the parties that it's supposed to benefit. That you will reinforce success and you will step away from failure. That you take every dollar seriously and every outcome is important. So you need to embrace and practice as an ethos the concept of stewardship. Next, use measurable performance benchmarks and hold yourself accountable to reaching them. Very important. Finally, make outcome and cost data easily available. Transparency is key here. Anybody wants to know, you give them the data. Put it up on a web page on a constantly updated basis. It becomes very, 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 very important to have full transparency. Finally, sustainability. Practice CQI and optimization. Over time, you're going to find that you're going to need to tweak things. There's always room for improvement. So have a process of CQI and optimization in the execution of your business plan over all horizons. Next, look for and measure the echoes. Again, the concept is that if you're successful, there will be measurable echoes in terms of the pattern of disruption, that you will actually be able to see those echoes and the disruption in care. Finally, over the long term, understand that a successful program should be largely self-financing through reduced placement costs. Again, 70 cents on every dollar in a child welfare agency is driven by placement costs. If you want something to be self-financing, you're going to have to disrupt that. You're going to have to disrupt that through entries, re-entries, duration, and setting mix. So now I'm going to turn it over to Morgan, who's going to take us through the next portion of the presentation.
Thanks, Dennis. And I'll just call out that we had one question in the chat that I responded to. People, please feel free to put questions in there, and we're going to save a few minutes at the end so that we can address anything that comes up. All right, so I want to give a bit of a snapshot around child welfare funding, including mental health services for child welfare involved youth and families, and what these funding sources look like at a high level. So this is specifically child welfare system spending at the national level, so aggregated all states and jurisdictions together by fund source. The important thing to really note here is that the majority of spending is state and local dollars. For all that there are, different funding sources available at the federal level, the majority of dollars spent do come from state and local coffers. So as Dennis has alluded to, be prepared to spend your own money on this. Chasing the federal dollars is not a wise strategy for a multitude of reasons. And in part just because it is ultimately going to be your own dollars being spent. In terms of federal funding sources or additional sources here, 4E is certainly a big factor here, with about 1/4 of all child welfare spending nationally. And the other one I want to call out here, although it is a smaller proportion, it's a particularly important one for the topic of mental health services, which is Medicaid. And that comes in at about 3%, but I would say is underutilized in a lot of systems in terms of supporting mental health services specifically, but services more broadly for the child welfare involved population. Next slide. So I want to spend just an extra moment on Medicaid specifically, because as I said, this really is a primary source for mental health services. So as anyone who has worked with Medicaid is aware, it is super complex and it varies significantly from state to state. So it's really important to be familiar with your own local landscape before trying to dive into pursuing Medicaid funding for anything. So these are some of the considerations to be aware of. This is certainly not a comprehensive list, but some of the things to be thinking about, which play a significant role in driving what the conversation around Medicaid is going to be. Are you in a state that is really not looking to expand their Medicaid spending at all? Or are you somewhere that they're happy to find those opportunities to do so, particularly if it is shifting costs from elsewhere that can then draw down additional federal reimbursement? What are the dynamics between your child welfare agency, for example, and your public health agency and your Medicaid agency? Do you all work together? Do you have a strong partnership, or are those extremely siloed? Are there any waivers or demonstration projects? Are there home and community-based waivers that would be particularly relevant to this population that you can look at as opposed to starting something entirely new? Do you have a managed care environment, and what does that look like? Do you have a carve out of behavioral health services or your child welfare population? All of these things are important to have some familiarity with as you begin to explore Medicaid as a potential funding option. Next slide. In terms of a bigger look at different funding sources, this is a fairly simplistic, but I would say applicable list of different funding streams, federal funding streams, primarily with the exception of the state and local funds, which is obviously cross-cutting throughout, divided by which agencies or which entity at the state as well as federal level administer those. For the topic of mental health services and adoption competent mental health services, that is unique in that you will potentially be able to draw from a lot of different funding sources depending on what you're trying to do, what you're trying to fund. And the complicating factor with that is not all of those are going to be administered by the same state or federal agencies. So you need to be prepared to work with those different entities to navigate that and to sometimes go into opportunities of braiding or blending those funding streams when possible, to come up with kind of a cohesive fiscal strategy for something. So those in red are the ones that are going to be most relevant for this particular population and set of services. So Title 4E dollars as a primary child welfare funding source, as well as Medicaid, and then state and local funds, kind of undergirding it all. But there are certainly others here in terms of federal block grants and other programs that are going to be worth consideration and exploration as well. I will highlight that all of these funding sources, such as the block grants that have a capped dollar amount, are generally going to be fully expended. It's not like there's a secret pot of money sitting somewhere unspent that you're going to be able to tap for this. For anything new. So often it's a little bit of a shell game, right? So it's determining, okay, so we may be able to use community services block grant to fund this new service, but then we're going to need to shift what that was previously funded to something else, which is why programs like Medicaid and 4E that have less limitations in terms of caps on them in most instances are often an appealing source for that reason as well. Next slide. All right, so with any funding source comes a whole lot of strings attached, and that is pretty much always going to be the case. Of course, some are more restrictive than others, but having some familiarity will really benefit you in navigating conversations and decision-making, to be aware of what those factors are at the minimum, to ask the right questions, to dig into the right details, and to have some familiarity with at the specific funding source level to the extent that it's applicable to your role or kind of initiative that you're looking to pursue. So things like, what's the eligible population? How does that align with the population I'm trying to serve with this initiative or not? Are there gaps in that? What are allowable expenses? Is there a state match requirement? Do we have to put up 20%? Do we have to put up 30%, 10%, whatever it may be, in order to access those federal dollars? What's the amount? As I was saying, is this a capped amount or not? Is it fully expended or are there funds available? What's the approval process from the feds in particular? How long does that normally take, and what degree of detail do you need to provide in order to get that approval? What level of documentation needs to be collected and retained about the service delivery or the spending in order to support submission of your claims to the feds or in case of an audit? And who's in charge? Who administers this at the state and federal level? So having familiarity and being able to look into those details as needed is important. Next slide. All right, so I briefly mentioned the idea of braiding or blending funding streams here. This is a visual that I believe Dennis created years ago and that I find to be a really nice, simple way of really visualizing one approach to the strategy of braiding funding streams. So the idea of pulling together multiple funding sources in order to ensure that you have a complete fiscal strategy and funding available for a particular initiative or effort. The idea, really simply being, start with your funding sources, that's the very bottom of the pyramid, that are most restrictive, that have the least flexibility, and see if those are applicable to what you're trying to do. So in this case, with the funding sources shown here, 4E and Medicaid are going to be generally the most restrictive because they, based on their eligibility requirements, the allowable costs, etc. So look at those and say, okay, can we fund this program with that in whole or in part? If in part, okay. So what proportion, what population, what set of services within the broader picture of what we're trying to do here can we fund with those? And then move up the pyramid. So TANF, 4B, SSBG, lastly, state and local funds. Do not apply state and local funds as your most flexible funding sources until you've exhausted your other efforts with other funding sources. So in this way, you can piece together the different funding streams from most restrictive to least until you have what is the remainder and is covered with state and local funds and fill that gap as the final piece. Just reiterating what we've said before, you shouldn't be funding and pursuing anything that you're not willing to, frankly, spend your own dollars on in whole. Dennis has often said, and it has been drilled into my mind over the years, that, for example, if you have a mediocre program that you're only spending 20 cents on the dollar on because you're drawing down 80% federal funds for it, at the end of the day, it's still a mediocre program, right? So the outcomes are still the same for kids and families or whoever you're trying to serve. So you're better off spending more money, coming up with that in order to do it, to invest in something that is truly going to target the disruption points, as we said earlier, that you really want to do, that is what is needed by your communities and by the folks that you're serving. And that will ultimately pay dividends by getting the outcomes that you need and then resulting in a better fiscal outcome as well in most cases. So this idea of braiding funds, just to reiterate, start with the most restrictive funding sources, move up in level of flexibility, and piece together what is needed with state and local funds being the final element. Next slide. All right, and you can go to the next one as well. So we're not going to go into any detail on this. I encourage folks to go out there and look things up that may spark your interest. And we're always open to future conversations as well. But this is just to highlight the idea that although things are incredibly complex in kind of the fiscal world of public systems, particularly, I would say, mental health and child welfare, and very slow moving. Like we all know that the bureaucracy, particularly at the federal level, means that things move very slowly, and that the current political climate also often tends to slow down progress in some ways. There are innovative, fabulous things happening in the field out there. And I'm not getting into any level of detail on these because it's entirely locally dependent, right? What works for California is not going to work for another state. What works for New Jersey is not going to be the best answer necessarily for your jurisdiction, but rather to highlight that there are things going on out there that are responsive to the needs of youth, family, and communities, that are having good impacts and that are using fiscal strategy in interesting ways. So for example, in California, they have recently announced a new foster care rate structure, which allows for a lot more flexibility of funding that is youth and family driven to support in part mental health and other needs of families. Also their CalAIM program, looking at their Medicaid program and how that can best meet the needs of youth and families. New Jersey, taking it from more of a services perspective, has long been a leader in many things related to this topic, but specifically calling out their mobile response and stabilization program is really integral in supporting the needs of kids that may need some behavioral health supports in a community setting with their families, to be responsive to their needs in a fast way and allow them to remain in their homes. And then lastly, looking at Oklahoma, they have recently made significant progress in their efforts around ending the need for group placement and supporting kids in staying in the community at home with family. In family settings, and approaching that in a co-design process and engaging their stakeholders and lived experts and community members and others to really work collaboratively to determine what are the efforts that are going to be most effective, and then what's the fiscal strategy to support those. Next slide. And next one. All right, so lastly, to close us out before we save a few moments for Q&A, a lot of the time when people are thinking about fiscal strategy, their mind immediately goes to things like RevMax, revenue maximization. Dennis and I get a lot of requests from jurisdictions of how can we maximize our federal revenue, or what's the best way to get money for this mental health service or this initiative. That is one part of the conversation, but I would argue it's not the most important one. And it's not the most effective lever in terms of looking at how you can implement and innovate efforts that are going to be impactful. So thinking about some of these other areas as well, some of these you're forced to think about, right? They will come up in the process of implementing any sort of the fiscal component of any new initiative or any, ongoing initiative. You'll be forced to consider these things. But thinking about them strategically as levers or tools for change is a valuable way to consider it as well. And this is an area where the center is also able to offer some supports through engagement as well. So keeping that in mind. So things like what are your interdepartmental or intergovernmental partnerships looking like? How can you improve the collaboration between Medicaid and child welfare agencies to kind of meet your shared goals? Procurement and contracting. How do we strengthen our contracts to increase provider accountability for better outcomes for kids and families? Rate structures. What's the kind of rate structure that's going to actually drive quality and best align with what we're trying to do, that doesn't have kind of unexpected or backwards incentives in it? Impact analysis, service array. So how do we expand our community-based mental health services when we have so much sunk cost in our system in residential placements and so many very strong provider organizations often in that field? The fiscal plumbing pieces that I just talked about a bit around funding, braiding funding streams. Provider development, looking at our provider community, what are the capacities that we may need to help them develop so that they're able to access some of this sustainable funding for high quality services? So for example, if Medicaid is going to be the most effective funding source for a community-based intensive mental health service delivery, but a lot of your mental health providers, for example, in your more rural areas are smaller kind of grassroots level organizations that don't necessarily have the billing infrastructure or the documentation infrastructure in place to be able to support Medicaid claiming. How do you deal with that? How do you address that? So these are a lot of the other considerations that really need to be kept in mind and that you will benefit from looking strategically at to explore and see what you can do in your system to really have a strong fiscal strategy around mental health services for child welfare involved families and those where adoption is in the play. All right, with that, we've got a little over 10 minutes, it looks like, for Q&A. So I will turn things over to my partners at the center to help us kind of facilitate that. But I think if folks want to either put things in the chat, we'll be able to answer some of those. Joaquin or Sarah, is that the best approach for folks to put them in the chat? I'm assuming everyone's muted.
Yes, it is. I do not see anything coming up right now, but that would be the best way to facilitate this. But if there are any burning questions that, if someone wants to come off mute, they're welcome to do that. Okay, I don't see any, Morgan.
Dennis, while folks are maybe still thinking or typing, is there anything that you would add as we close out, just to give folks another moment for any questions? Looks like Dennis is battling with his mute button.
Let's say that mute button.
There you go, Dennis.
There you go. I'm not, yes, I know. No, other than it would tell the audience you've heard a lot, you've seen a lot on this. It's doable. It looks complicated, and it is. Finance, particularly in this area, is in many ways a black box. But it's a black box that can be unraveled. and made more transparent, particularly to appropriators. All we talked about today are things that can be accomplished. All the things we talked about today are things that we can do. And this is the type of technical assistance, particularly in this area, that will probably be available through the National Center. Don't be afraid of it. It's a necessary predicate to the work that you want to do.
Okay, thank you both. I still do not see any questions.
All right. Well, thank you everyone for your time and attention today. And I hope everyone has a wonderful day.
It looks like we're losing a lot of people, but I was going to say before everybody goes, we needed to put up the.
Joaquin, you went on mute. Yep. Oh, there we go. Survey link.
Not sure why I keep muting. Oh my goodness.
It sounds like there's a survey, a follow-up survey link. Oh, there we go. That Joaquin just put in the chat. Joaquin, will that be emailed out as well to
Yes,
participants?
we'll also, it was on the last slide as well. It should have been on the last slide here. Sarah, I don't know if you see it or not, but it is okay. We will make sure we get it emailed out as well.
Yeah, this is the last slide I've got here.
Okay, thank you.
All right. Thank you, everyone.
Enjoy a great day.